In another video, I share how a cannabis company can implement good agricultural and/or good manufacturing practices to achieve lasting results without getting lost in needless complexity and cost. This video presents the key concepts of GxP that was not covered in the other video. In GxP, the G and the P stand for good practices. The X is written in lowercase to represent an industry or sector, such as GACP for good agricultural and collection practices, and GMP for good manufacturing practices. And there's good laboratory practices, good hygienic practices, and others. Some differences exist between agriculture, manufacturing, and test lab operations, but the basic concepts and activities of good practice frameworks are very similar. There are various standards, frameworks, and regulations around GxPs that add confusion. You shouldn't have to do excessive research to understand the basic concepts. From a very high level, GxP is everyone knowing what they need to do, knowing how to do it, and having the proper resources to reliably produce quality results year after year. This requires 1. Having robust processes that consistently and reliably produce safe cannabis products. 2. Having preventative controls and safeguards in place to reduce the possibility of failures. And 3. Having production records available to investigate the cause of an issue to improve the system. I'll break GMP into 12 categories. First one, management, commitment, and leadership using quality principles. 2, documentation of policies and procedures. 3, staff qualifications and training. 4, having proper facilities, equipment, and maintenance practices. 5, validation of critical processes. 6, hazard analysis and risk-based preventative controls. 7, addressing complaints, recalls, and corrective actions. 8, customer focus and supplier management. 9, good record keeping. 10, managing and implementing change. 11, self-assessment to identify and resolve gaps. And finally, continuous quality improvement. I can talk for 15 minutes on each of these 12 topics, but that would be a 3-hour video. So I'll cover the basic concepts. Let's jump in. Management, commitment, and leadership using quality principles. Management commitment is critical for successful implementation and year after year quality results. I have another video on the critical role of top management. Management should set the GxP policy and strategies, plan, delegate responsibilities and authority, lead by example, focus on process management, align the system with GxP goals, and maintain constructive levels of engagement by requiring internal gap assessments, reviewing the performance results, and providing resources to resolve gaps. Documentation of policies and procedures. GxP requires policies, critical processes, and procedures to be documented and changes to be controlled and managed. This means not making process changes based on a whim or assumption that a change will improve things or be more efficient. Decisions should be based on analysis and data. A process change needs to be thoroughly planned, documented, and communicated to all affected personnel and affected stakeholders so that the new method is performed consistently by all. Work instructions, warning signs, area markings, and other job aids are as important as the critical procedure documentation. Document management includes review, approval of changes, and revision logs maintained to support future issue root cause analysis. Staff qualification and training. I tell new hires and remind staff, I selected you for your skills and knowledge, but I hired you to follow the documented procedures and to support process improvement. To support good HR practices, the education, experience, and knowledge requirements for each job role should be documented. Training plans need to be established for each role. Hiring should be based on qualifications, and staff should be trained to perform procedures reliably. Training can be accomplished in many ways. Our GapCross applications provide training and daily process guidance. Job aids are a good form of training. Staff must perform work correctly, including cleaning, sanitation, good hygiene, and safety practices that are critical to ensure safe, consumable cannabis products and working condition. Everyone needs training to understand the value of supporting continuous improvement. Offboarding procedures need to be defined to remove physical and digital access to prevent post-employment access issues. Having proper facilities, equipment, and maintenance practices. The grounds and buildings need to prevent intrusion of pest and contaminant sources from water and air. Porous surfaces and cracks must be avoided to prevent places for microbes to grow. The risk of foreign objects getting into product from broken glass, metal shavings, hair, jewelry, or other sources needs to be prevented. Contamination from allergens such as nuts, cleaning chemicals, or pesticides need to be managed. The facility and storage area layout should be designed so that movement and holding incoming supplies, interim and final product, rejected product, byproducts, and waste do not cross-contaminate final products or get mixed in. Clean food-grade surfaces, equipment, and utensils are required. Validation of critical processes. Critical equipment must be properly installed, calibrated, maintained, and performance verified under production loads. This is referred to as design qualification, installation qualification, operational qualification, and performance qualification. While DQ, IQ, OQ, PQ is the hallmark of a pharmaceutical industry, its principles can be applied beneficially to food, dietary supplements, and the cannabis industry. Next is hazard analysis and risk-based preventative controls. In several industries and regions of the world, this is referred to as HACCP, pronounced HACCP, for Hazard Analysis and Critical Control Point. This is a system adopted by the Codex Alimentarius Commission, established by the International Food and Agricultural Organization and the World Health Organization. The basic concepts of hazardous analysis and risk-based preventive controls is having a cannabis product safety plan, identifying potential foreseeable hazards such as microbial contamination for packaging, drying, storage. Hazards can be biological, chemical, or physical, such as glass and metal fragments in a product. Each potential hazard throughout a process can be evaluated for the potential of occurring and the severity if it does occur. Potential hazards that have a high probability of occurring and a high severity if they do occur should be addressed first. Next is designing and documenting preventative controls, such as segregation of allergens like nuts, and control point parameters such as minimum and maximum humidity levels during harvest, drying to reduce microbial growth, and finally implementing control practices and safeguards such as shatterproof glass, humidity control plans, and what I call idiot-proofing a process so that mistakes can't be made. Addressing complaints, recalls, and corrective and preventive action. Things can go wrong, and a process for addressing customer complaints, especially adverse health or product safety events. A recall plan and a documented procedure for CAPA, that's corrective and preventive action. All of these are required. Correcting a problem without discovering the root cause of a problem is a guarantee it will happen again. Good record keeping is essential for root cause analysis. Recall plans need to work when required. Just like an emergency evacuation plan, recall plans need to be tested using mock drills to ensure that proper records enable an operation to know what production lots need to be recalled and what sits in inventory, what has been distributed, and who to contact to get the word out. Next, customer focus and supplier management. Your product quality depends on the supplies you get in, and it's not just the quality of the supplies. Many states require that medical cannabis products need to be reliably available to patients at all times. Supplier management is critical. It's out the door and not my problem is not a GxP concept, nor is it's the supplier's fault and responsibility. Wherever you are in the supply chain, you have suppliers and either B2B or B2C customers. If your products are packaged or labeled in a manner that will create a hazard for a consumer, such as non-food grade packaging, packaging that does not maintain the product quality, contains pesticides, or is labeled as low THC but the product is high THC, you will have a problem. Supplier management includes identifying your critical supplies, defining the quality parameters for each supply, selecting suppliers that can reliably provide quality products, and monitoring your suppliers' good practices. GapCross has a supplier management self-assessment to identify gaps in your supply practices, and another supplier assessment that you can use to evaluate, select, and monitor ongoing supplier GxP and quality practices. These two assessments are based on the ASTM International Standard D8477, described in this news story at bit.ly/D8477. Good record keeping. Records are like insurance. You hope you don't need to use them. When you do, it's very nice if you can find what you are looking for quickly. With cannabis, many different types of records are required by state regulation, including, but certainly not limited to, financial, batch production records, equipment calibration, material change, sanitation, product test results, and pesticide application records. Production batch records document the exact quantities, temperatures, processing time, pressures, and other details for manufacturing step that occur during each batch. This data is invaluable for investigating complaints or product recalls. Any required or voluntary third-party certification audits will review your documented standard operating procedures and records to determine that the operation has a solid foundation of good practices. Retention of records is important, and good retrieval methods are critical. A record management plan should list the type of critical records, the purpose of the record, where and how it is stored and retrieved, access controls and methods, and the privacy, intellectual property, and disposal requirements. Managing and implementing change. Change happens, but Forrest Gump said it more precisely. Whether it's an absent employee, staff turnover, something breaks, a new product, identification of a hazard, process improvement, or a supplier or other issue that pops up out of nowhere, you need a solid change management procedure. Food management often refers to a change to a standard production batch procedure. In this case, there are planned and unplanned changes. Planned changes are documented, and as applicable, process are changed, staff is trained, equipment is changed, ingredients are changed, and all the changes are reviewed, tested, and approved prior to deployment. Unplanned changes are a reactive experience where issues with final product may need to be contained or recalled, and further production may need to be halted. Analysis may be required to find the root cause. The root cause could result from any of the other 11 GxP elements, from leadership, staffing qualification and training, the facilities or equipment, hazard analysis, a supply issue, or others. Prior to implementing any change, you should ask, does this change require a change to procedures? Does it require a leadership action? Is there a change to roles or responsibilities? Training, the facilities or equipment? Is stakeholder communication, approval from regulators, testing, a pilot program, or validation needed? Most of these areas would not be applicable to many changes, but it is a good idea to follow a checklist so that nothing is missed. GapCross can be used to create your own custom, yet consistent checklist and capture data for permanent records of each major change management event. Self-assessment to identify gaps and prevent issues. By performing a comprehensive self-assessment, you can not only identify gaps, but also learn the requirements of a GxP framework. I have a video on using self-assessments as a GxP training tool. The individuals that perform a self-assessment learn far more about the requirements and the status of the operation than others that only read a report. I produced ASTM Standard Practice D8308 on audits and self-assessments, described in a news story at bit.ly/CanAudit. Continuous quality improvement. I believe continuous improvement is the most important practice for GxP implementation after management commitment. As I said earlier, everyone needs to be responsible and involved with continuous improvement activities. This drives the system towards improved quality year after year. A culture of continuous improvement and quality needs to be inculcated throughout the organization, from top management down to every employee. For a successful implementation, the GxP requirements and daily actions must be integrated into the production activities and be indistinguishable from the traditional daily production activities. Everyone should know how to report an issue or make a suggestion. A process to quickly categorize and evaluate these reported issues and suggestions is needed. From there, it's just a matter of aligning and prioritizing the improvement activities with strategic plans and available resources. To repeat myself, continuous improvement is the most important of these 12 practices for a successful GxP implementation. GapCross provides several pre-designed assessments and audits based on state FDA GxP regulations, state cannabis regulations, and ASTM international standards. You can also design your own assessments and procedural checklist applications to meet your custom needs. To learn more, visit gapcross.com. Thank you for watching this video. Be sure to like, share, and subscribe for more informative content, and leave a comment below if you have any questions or experiences with cannabis, GACP, GMP, or GLP implementations.